Thank you so much for the introduction, and it's my great pleasure to be with all of you here. I would like to thank the organizers for inviting me, and I would like to congratulate everyone on the outstanding presentations that we had until today and the work that has been done by the IDF and DAR. So we have seen that the potential physical benefits associated with Ramadan fasting, that weight loss after Ramadan, and it may improve the HbA1c, cholesterol, and blood pressure levels, and might even relate it to better outcomes for people with fatty liver disease. And I was privileged by the invitation from Dr. Mohammed Hassanein, who has inspired me really to start working about Ramadan. And since then, we have always been trying to conduct new studies. I was privileged to be part of the guidelines, to be in charge for the chapter with my colleagues for Ramadan sleep and physical activities. So when it comes to lifestyle changes accompanying the Ramadan fast and effect of mental well-being, it's really important to look at and take a deeper aspects on what happens on your physical activity and what happens to the sleep and circadian rhythm and what happens to other, smoking habits and many other things. Well, we're well aware that muscles and metabolic health is really important in, in diabetes, both in type 1 and type 2. And nowadays, we know that the strength has a related to diabetes risk. So now we have initiated in DASMAN that all people that comes to in the clinic in diabetes, they will measure the strength as part of their vital signs. And as we have seen, we have conducted the studies at more than 2,000 people, and we have published our data, both in people with type 1 and type 2 diabetes. And we see that the muscle strength compared to the UK is much, we have compared our data to the UK Biobank, and we have seen that, overall our muscle strength is much less, and our inactivity is also, not too bad when it comes to the light activity, but we're much less when it comes to moderate activity and vigorous activity. And also when we looked at sleep deficiency and sleep duration, both are, hugely discriminated between Kuwait data and the UK Biobank average data. And we know muscle strength is really important, and it's, one of the predictors for the type 2 diabetes and also very important for our type 1 diabetes. So, low muscle strength is highly evident in our publications looking at the strength. And, it's both in prevalent type 1 and type 2. So we wanted to look at ways how we can improve the muscle strength. And of course, you're well aware that the physical activity benefits is not only, for the immediate activities of muscle strength, but it also has beyond like sleep and anxieties and blood pressures and many other factors. And when we looked at the physical activities in both of the cohort of our type 1 and type 2 diabetes, we have asked people to wear, the accelerometers. These are expensive devices that we use for research. To compare the activities, we see that our people are really, having problems in both. And this is just to show you some of the graphs that we have looked at. And you see where is the activity timing, in people with diabetes. So these are the accelerometer data that we often use, for the research, where it gives you, the exact measurements of both, inactivities, light activity, moderate activity, speed activity, and the whole timings. And when we looked at this data, comparing the 4 seasonal variations in Kuwait, summer, autumn, winter, and then we added Ramadan specific, and see how people make it a difference when it comes to Ramadan compared to other, times of the years. And you will see from this that, the inactivity increases in Ramadan, but it is not the light time activity actually increases, so it gets better in Ramadan, but the vigorous activity gets less in Ramadan. And if you see the sleep, we would often think that the sleep would be affected, but the duration is not significant really, and the sleep efficiency, it doesn't get much less. So this is a really great to know about it. And what we wanted really to focus more on our type 1 diabetes people and to see the benefits of exercise, among people with type 1 diabetes. It has a lot of advantages, improving bone health, which is, a huge problem in our type 1 populations, and, improving muscle health and muscle strength. And I think the difficulty it comes, with the type 1 advice always is, regarding is the, people fear of hypoglycemia, and many people, are probably not very much focused on exercise in type 1 diabetes. So we have conducted last Ramadan as a randomized controlled trial to really to see, the effect of the both exercises, and most importantly, to focus on the timing of the exercise. So, when would you advise your patients to do the exercise? Would you do it, during fasting or after breaking the fast? And we've done this in a randomized controlled trial in our people with type 1 diabetes. So this is the study design where we have put people, on glucose monitors and also, of course, on accelerometers, and they have been monitored by exercise classes that have been done remotely through video conferencing. And these exercises classes mainly to focus on also muscle strength and beyond. So we've done the 1 week of normal activity, then, people would be randomized to this of 1 week of exercise before the breaking fast, and then you would wash it out and you would put people to walk after breaking the fast. And we would do this in a random fashion. So people would get randomized, in a random fashion to any of the groups to be, before fasting or after fasting. And surprisingly, if you see the results, the red is the baselines, and you see, before is the blue and the green is after breaking the fast, there isn't much difference at all when it comes to glucose. And this is in a way is a safe modality. And when we want to focus even more about people before iftar and after iftar, and looking at their activities and at their average blood glucose, you will see there isn't much difference if people would do it before iftar or after iftar. The only advantage is if you do before iftar, you would get, even a better glucose under the area curve. When you look at hypoglycemia, which was very surprising that you don't get, more hypoglycemia if you're doing it, while fasting. If anything, the post-exercise timing of during the after iftar, you will see that you have a higher risk of hypoglycemia in the next day. So, which is interesting in a way. Normoglycemia was achieved in both iftar and pre-iftar, so really wasn't much a difference. And if you see hyperglycemia was a bit better, in the post-iftar compared to the pre-iftar. So these are really to show you the coefficient variation between two groups. And this is just to see the results of the activity among the day of all the timing during the day. So, with this randomized really controlled trial, we really wanted to ask a simple question, but it's often a very important question is, when would you advise your patients to do your exercise, especially in type 1 diabetes, where we all have the fear of hypoglycemia and also, wondering what do we do with these people. So we have seen from the randomized controlled trial that the physical activity had beyond, benefits of not only lowering risk, but also, lowering risk of hypoglycemia. And if you see from the accelerometer data, you would see also, things are, getting different. So what are our new directions and trends in 2020? So when it comes to people asking you what time is best to exercise, we always used to give this, as a probably expert opinions or without having a real, best evidence. But that's why we conducted the randomized controlled trial to look into this and deeply into type 1. And we really need to probably mimic this data in type 2. But as you know, in type 2, things gets a bit more complex because you have to separate for people who are on insulin versus people not on insulin. So, you need to do probably multiple randomized control trial. I would like also to point that, most of these patients who have been in our randomized control trials are our Daphne graduates. So these people probably know how to manage their insulins, when it comes to exercise and really hands-on when it comes to carb counting and managing their blood glucose. But again, really to show you that it is safe to effectively, exercise while you're fasting. And if anything, it has even, a similar results of hypoglycemia. There's no increase at all in hypoglycemia. And it has a greater benefit that the less hypoglycemia, post-exercise. What about sleep restrictions? So We know that sleep restriction is really related to increased risk of diabetes and even to worse outcomes of, glycemic variability. And this is often a question that, would be asked, what happens to people in Ramadan? What's the effect of sleep, in Ramadan? With people staying later hours during the day and, probably do not sleep until they have the suhoor. And then the whole day, comes into jeopardy a bit. Well, surprisingly, when we looked into this data, that the sleep duration wasn't much affected, compared to Ramadan and non-Ramadan times, and probably because people nap during the day while they're fasting. So that's, another explanation. But the sleep efficiency also stayed the same, so it wasn't really affected much. But we really need to run into this. This was a cross-sectional study for this data, and we really need to take this opportunity to develop, more sleep interventions for the future and how we can get this more into their glucose variability and what happens to their glucose as well. We know from people who have time shifts, especially in both type 1 and type 2 diabetes, it leads to huge glucose variability. So we need to delve more into this, how sleep restrictions, if people nap or do not nap, have a difference on their glucose outcomes and glucose variability. So, there aren't many yet interventions to improve sleep, but sleep extension is feasible and need to come to more studies. So with this, I would like to thank my group at the Jasmine Diabetes Institute, and I would like to thank you all and really wanted to share with you the latest that we have produced last year, on the randomized control trial on the effect of, timing of exercise for people with type 1 diabetes who all have fasted during Ramadan, and when would be best to advise on your fasting. Thank you all and have a wonderful day.